The majority of people believe that health examinations are always beneficial, but what if I told you that certain of them could really endanger your life after you reach a certain age? I understand that this may sound odd, but not all exams and screenings are innocuous. In actuality, several of the most popular examinations for senior citizens may result in risky treatments, needless anxiety, and false alarms. That isn't inciting terror. More and more medical professionals are starting to recognize this, particularly when treating patients who are older than 70. A new reality is dawning on the medical community. As we mature, one-size-fits-all testing may cause more harm than good. We're going to examine 5 particular health examinations that seniors might be better off avoiding in detail in this video. Screenings that even seasoned medical professionals frequently decline for personal reasons. We'll look at the reasons behind the widespread recommendations for these tests, their unspoken risks, and safer substitutes that educate you without endangering you. Are you watching this on your TV? If you find it helpful, you can use your phone or remote to search for our channel on YouTube. Then hit the subscribe button and turn on the bell so you never miss a new video on health, nutrition, and senior living. And if you enjoyed it, don't forget to give us a thumbs up or leave a comment. We truly appreciate hearing from you. You are entitled to health treatment that honors your physical attributes, age, and overall well-being. This video is for you if you have a strong concern for your health, but don't want to be overtreated, over-medicated, or overburdened by the current healthcare system. Our purpose is not to frighten you. Our goal is to provide you with information, self-assurance, and a better understanding of what actually promotes your health after the age of 70. Let's get started. The colonoscopy trap is the first. The gold standard for preventing colon cancer has long been colonoscopy. However, this test may suddenly become more detrimental than beneficial after the age of 70, particularly in those without symptoms or a family history after a while. A screening that could have saved your life in your 50s or 60s can become a cause of needless risk, anxiety, and even hospitalization. Why for? The process itself is a serious concern. Sedation, thorough bowel preparation, and the insertion of a scope deep into your intestines are all part of the procedure. For a younger adult, that would be exhausting enough, but the hazards increase dramatically for older persons. Seniors are at risk for serious electrolyte imbalances and dehydration from the stool cleansing process alone. Additionally, older bodies may be more susceptible to the sedatives used during the surgery, which can cause confusion, lightheadedness, and a higher risk of falls. However, there's something much more worrisome. Following a colonoscopy, many older persons, particularly those over 75, get follow-up procedures or treatments for tiny polyps that may never have been harmful in the first place. It frequently takes 10 to 15 years for these slowly developing anomalies to become problematic, and those years might never matter to someone in their 70s or 80s, however. The revelation instills fear in the name of preventive. It initiates a series of tests, including biopsies, repeat scopes, and even partial bowel resection. However, prevention turns into damage when these hazards outweigh their benefits. This is an example I will always remember. Despite the fact that he had no digestive problems, my buddy George, who is 82 years old, active and as sharp as a tack, was persuaded to have a normal colonoscopy. He became really dehydrated during the preparation. He was sleepy and disoriented after the surgery, and he broke his hip when he fell at home that evening. That one test resulted in stress, medical expenditures, and months of rehabilitation. And you know what? Nothing was discovered by the scope. Blaming doctors is not the point here. They're carrying out their training. However, as medicine changes, we must also change. It's absolutely acceptable to decline a colonoscopy if you're over 70 and symptom-free. Nowadays, many people find non-invasive stool testing to be safer, simpler, and more efficient. It involves assessing the actual financial, emotional and physical costs of subjecting your body to something that might not be beneficial. Better treatment after the age of 70 frequently entails fewer interventions and more deliberate decisions, so we must stop assuming that more testing always equates to better care. Being cautious does not mean that you are ignoring your health. You're paying respect to it. Second place, the yearly error of the full body scan. The concept of a whole body scan has an alluring quality. It sounds like clever prevention to have a machine examine every part of you from head to toe and find any hidden problems before they become problems. However, this strategy may work against seniors over 70 more often than it helps, although. The goal of complete body scans may appear proactive. The results they yield frequently trigger a chain reaction of anxiety, intrusive testing, and even needless procedures that can shorten, rather than prolong your life. Let's be clear, MR is in full-body CT. Scans are not your usual screening methods. These powerful tools are made to detect everything, and I mean everything including innocuous anomalies, that have no bearing on your lifespan or health. These so-called incidental observations have the potential to become mental time bombs. A tiny nodule here, a shadow there, and all of a sudden you're on a never-ending cycle of follow-up visits, biopsies and specialists, all in pursuit of something that may never have been important. Why is this more significant after the age of 70? Because the aging body no longer reacts in the same manner. What would have been a straightforward biopsy at age 45 can now result in weeks of recuperation, an infection or a collapsed lung for aging joints. Even something as simple as lying motionless for an MRI can be physically taxing or uncomfortable, and many people don't discuss the emotional toll. Instead of appreciating their current state of health, seniors frequently bear the burden of worrying about what might be. Consider Betty, a 78-year-old lady I met at a conference on senior health. She had no complaints, was active and went for daily walks. However, a mobile clinic gave her an inexpensive, full-body scan at a health fair. On her kidney they discovered a microscopic lesion that had not caused any problems, and probably never would. But terror was sparked just by the word lesion. She had surgery within a month. The fallout, months of recuperation, a decline in vitality and persistent issues that never completely disappeared. All for something that may have stayed unsaid for all time. It's known as overdiagnosis. In medicine, it's known as needless fear. On an emotional level, it is also financially exhausting. Insurance seldom covers full body scans. Many seniors wind up paying out of pocket, believing they are purchasing peace of mind, unless they have a compelling cause. In reality, though, they are purchasing a ticket to a system that might never cease testing. However, duty appears different in this stage of life. It entails having a little more faith in your body. It entails paying attention to your feelings rather than just what computers say. It also entails realizing that not every shadow on a screen is worthy of your dread or your energy. Please let me know in the second remark below if you're still watching this video and finding these ideas helpful. To ensure you don't miss any videos, I advise you to subscribe and turn on the bell. If you haven't already, we can keep producing high-quality content to educate and uplift you. Thanks to your support, alright. Let's proceed. The third issue is the overuse of cardiac stress tests. The treadmill stress test has long been regarded as the standard technique for identifying cardiac problems, particularly in elderly people. The reasoning is straightforward. See how your heart reacts to pressure by pushing it. However, such reasoning can backfire after the age of 70 in ways that many seniors are unaware of until it is too late after a certain age. A surgery that was once helpful in your 50s and early 60s turns into a dubious and occasionally hazardous one. The reason is that elder cardiac stress tests frequently produce what medical professionals refer to as false positives. This indicates that even while your heart is functioning perfectly, the results can indicate that you have a cardiac condition. Our bodies naturally alter as we age, which leads to these deceptive effects. The heart's electrical patterns change. Arteries tighten and blood pressure varies more, all of which are not always signs of illness. However, the stress test is unaware of that. It just notices something out of the ordinary, which can set off a chain reaction of anxiety and additional testing angiograms, catheterizations, and occasionally, even stent placements or bypass procedures are all part of that cascade. And they all carry significant dangers. Those dangers are not insignificant for elderly. We are discussing the risks of blood pressure decreases, hemorrhage and kidney damage from contrast dye. Recovery after surgeries is more difficult, and complications increase. You can find yourself in a hospital bed wondering how it all occurred, after what begins as a straightforward treadmill test. Let me introduce you to George, a retired bus driver who is 74 years old. During a normal medical, his doctor requested a stress test just to be safe, although he experienced no chest pain, shortness of breath, or fatigue. The next thing he knew, he was being referred to a cardiologist because the results were questionable. 3 weeks later, he was having an angioplasty to remove a blockage that was causing no symptoms. George had a serious infection at the catheter site. Within a month of the procedure, ended up in the intensive care unit and spent the following 6 months in and out of rehabilitation. He has never totally recovered in terms of his quality of life. Now consider whether that treadmill was worthwhile. In actuality, a large number of reputable heart physicians and geriatric societies now advise against routinely testing asymptomatic, older persons with stress. They concur that there is frequently little benefit and serious potential danger if you are not experiencing any symptoms, such as chest pain, shortness of breath, or inexplicable lethargy. This is particularly true if you want to live well, rather than live forever in terms of psychology. The concept of examining your heart has a strong appeal. We feel that our hearts are fundamental to who we are. It's life's drumbeat as a result. We naturally desire to ensure its health. This is when wisdom enters the picture. The goal of healthy aging is not to solve every possible issue. Avoiding medical excess that can take more than it offers, staying independent, and paying attention to your health are all important. That does not imply that you should disregard the health of your heart. Not at all, but concentrate on the basics. Rather than hopping on the treadmill in your doctor's office, walking every day, eating a healthy diet, maintaining social relationships, and controlling your stress. After 70, those are the things that genuinely keep your heart healthy, not devices, not cables, and not examinations made for individuals half your age. This time in our lives, discretion is more important than anything else. The guts to decline something simply because it's offered. The ability to recognize that not all tests are gifts, and that sometimes turning them down is the best thing you can do for your life. The thought of colon cancer has an eerie quality. It can strike without warning, and by the time symptoms show up, it may be too late for many years. Colonoscopies were hailed as one of the most crucial preventative procedures in contemporary medicine. Because of this, here's the truth though. Many people are unaware that the hazards of colonoscopies frequently outweigh the benefits at a certain age, especially beyond 70. Additionally, this test may do more harm than good for certain elders. Let's begin with the actual process. Complete sedation is necessary for colonoscopies, and anesthesia poses significant dangers to elderly patients. As you age, your brain becomes more susceptible to the effects of sedatives, and your liver metabolizes drugs more slowly. Post-operative cognitive dysfunction, a fancy word for persistent confusion, memory problems, and brain fog that can persist for weeks or even months following the treatment, is therefore more likely to occur in older individuals. Then comes the preparation of the bowel. You are familiar with this portion if you have ever had a colonoscopy. Consuming copious amounts of strong laxatives to cleanse your body, however, that process can be upsetting and dehydrating. For elderly people, it disrupts your electrolyte balance, interferes with renal function, and can leave you feeling emotionally and physically exhausted. One incorrect step can cause lightheadedness, vertigo, and possibly even a nighttime fall in the restroom. That isn't overstating things. Colonoscopy preparation falls are more frequent than most people realize, particularly among elderly adults living alone. Nevertheless, this is arguably the most neglected problem. The benefit time horizon, the purpose of colonoscopies, is to find slow-growing polyps that could turn into cancer in 10 to 15 years. But the chances of those polyps developing into anything harmful in your remaining years are quite slim if you're already in your 70s or 80s and have had previous clean tests. Indeed, several medical societies now state that as people age, the risk of problems like bleeding, perforation, and bad drug reactions rises dramatically, while the potential benefit becomes negligible. Consider the example of Eileen, a retired schoolteacher who is 78 years old. At ages 68 and 73, she underwent a clear colonoscopy. To be safe though, her doctor recommended one more. At age 78, she concurred. Her colon was inadvertently perforated during the treatment, which is an uncommon but dangerous consequence. She stayed in the hospital for about a month. After undergoing emergency surgery, Eileen lived, but her independence waned, and she never recovered her former level of vitality. She frequently expresses her wish that someone had forewarned her that the test might not be worth the cost. What causes this to occur? It's partly a medical habit. Something must still be excellent at 75. If it worked at 50, however, aging alters the situation. What used to protect us can now become a burden. And although cancer is a legitimate worry, it frequently causes people to lose sight of their true objectives during this stage of life. Maintaining mental acuity, emotional stability, and ability for a slight increase in longevity. No screening test, no matter how sophisticated, is worth compromising those cornerstones. At this age, it's more important to pay attention to symptoms that are genuinely present, such as blood in your stool, persistent abdominal pain, or unexplained weight loss. Yes, an investigation is definitely necessary in those situations, however. If there are no symptoms and a good history of screening, a normal colonoscopy might not only be risky but also unnecessary. We need to take back our agency here. Understanding the trade-offs is a necessary part of being informed, not only following processes, because that's what you're expected to do. Your body deserves to be treated with respect and not exposed to risks that no longer provide a commensurate advantage. Please let me know you're still watching this video and finding these ideas helpful by leaving a comment in no4 below. To ensure you don't miss any videos, I advise you to subscribe and turn on the bell. If you haven't already, we can keep producing high-quality content to educate and uplift you. Thanks to your support. Alright, let's proceed. Fifth, regular heart stress tests being used excessively. Something about heart illness gives the impression that it is a ticking time bomb. There are tales of people who appeared to be in good health one day and then abruptly passed out the next. Therefore, it makes sense to wish to identify any problems as soon as possible. This is the reason why cardiac stress tests, treadmill or chemical tests that track how your heart reacts to pressure, have become so popular, particularly among adults over 70. Here's the unexpected reality though. These examinations cause more harm than help for a large number of seniors, particularly those who have no cardiac symptoms. The concept of a stress test seems comforting. They monitor your heartbeat while you walk on a treadmill, and they take action if something seems odd. However, the truth is more nuanced. The cardiovascular system already exhibits age-related alterations in the majority of adults over 70. Mild arterial stiffness, a small amount of plaque here and there, or a longer recovery period following physical activity. These are frequently typical aging symptoms. However, when they appear on a stress test, physicians can see them as warning signs, which could lead to additional testing and potentially needless treatments like stent insertions or angiograms. That's the dangerous part. There are repercussions for those follow-up operations. particularly in elderly patients with weakened blood arteries and diminished renal function. Catheterizations may result in bleeding, stroke or kidney injury, and it's difficult to go back. Once you've gone down that path, one test results in another, and so on. Before you know it, you've undergone a series of treatments for an illness that might not have even bothered you in the first place. Consider Harold, his 76-year-old Illinois grandfather. He had no chest pain or despair, was walking every day, and was playing with his grandchildren. To be sure, his doctor recommended a stress test during his yearly physical. A cardiac catheterization detected some non-obstructive plaque. After the test revealed a little irregularity, still the physicians implanted a stent due to a test that was unnecessary and based on a non-urgent issue. Harold experienced complications from the blood thinners following the treatment, ended up in the hospital with internal bleeding, and spent the following 3 months recuperating. What causes this to occur then? Fear is a contributing factor, both of missing something and of what might occur if we do nothing. But rather than chasing after unidentified issues, it's crucial to prioritize quality over quantity at this point in life in order to preserve energy, independence, and comfort. Nowadays, a large number of reputable cardiologists advise against routinely assessing symptomless elderly persons for stress. It simply isn't supported by enough evidence. It doesn't decrease mortality or heart attacks, and it's not only needless but also potentially harmful for people who don't exhibit any symptoms, like dizziness, shortness of breath with little effort, or chest pain. Symptom-based care is the better course of action. Yes, evaluation makes sense if you experience changes in your mood during activities such as weariness, pressure, or racing heartbeat. However, your body is already telling you a more accurate tale than a computer can if you're feeling stable, getting enough sleep, and maintaining an active lifestyle. Aggressive involvement must give way to careful observation. As we get older, it isn't about surrendering. It's about leading a prudent life. You don't have to battle every illness that could arise. You must safeguard your dignity, your time, and your clarity. Being older does not equate to being powerless. If anything, it's the moment in life when we're mature enough to pause down, ask ourselves, is this really for me? And challenge the system you see. Sometimes the bravest course of action is to do less in a society that exalts more tests, more checkups, more medications, and not from carelessness, but from a profound comprehension of your body, your values, and your objectives. At this point in your life, when you're in your 70s and beyond, healthcare shouldn't be a series of impersonal procedures and automated tests. It should be a discussion about your priorities, your ideal lifestyle, and the risks you are actually willing to take. Following procedures that were created for younger bodies mindlessly can cost you years of your life, as well as your energy and a peace of mind. The doctors are taught in a system that frequently promotes sickness rather than respecting health, not because they intend to create harm. This film has already served its purpose if it caused you to reconsider, or if it provided you with a fresh perspective on your health. Additionally, refusing some tests does not imply that you are neglecting your health. It indicates that you are being purposeful. You're balancing the advantages and disadvantages. You're realizing that not all tests result in understanding some, lead directly into the tangle of anxiety, overdiagnosis, and needless treatment. So assume responsibility. Communicate honestly with your physician. Inquire as to if the exam will likely alter the papers or the final result. Consider your comfort, your time, and your energy, as they are valuable at this age. You deserve to live your life as you see fit, without fear, but with consideration, without being overburdened with processes, but empowered with knowledge, and without always preparing for illness, but instead actively constructing a meaningful, joyful, and connected life. We appreciate you being here with us today. We would be delighted to hear from you. Tell us about one thing you learned today and how you intend to apply it in your life in the comment section below. We value your opinions, so please feel free to express them. We are greatly inspired and encouraged by reading your remarks. Please like, subscribe, and share this video if you found it entertaining and useful. We can keep producing high-quality content to educate and uplift you thanks to your support. We appreciate your time and hope to see you in the upcoming video.